Today, let us see about central acting nervous system stimulants. Under drugs acting central nervous system, we have studied already about the major class of agent which shows its action by depressant. So only a few drugs we have under CNS stimulants which are therapeutically used. So let us see about such agents. They have only limited applications in the medicinal field. Before entering, let us see about the definition. Central nervous system stimulants are the psychoactive drugs that induce temporary improvement in either mental or physical functions or both. Now in the previous class we came across with nootropic agents. So here cognition enhancers also the alternate word which was used for nootropic agents. Psychoactive agents are the drugs which can improve the cognition behavior of a person. It's a temporary response actually, where mental as well as physical function or sometimes both may be enhanced by such agents. Only it's a time being. So medicinal uses are very much limited. It can be used in attention deficient hyperactivity disorders, which is called as ADHD. Especially it can be observed in children. And the sympathomimetic agents also we came across with amphetamine agents. So they cause as CNS stimulants. So thereby they can show the response. And other than it can be used as narcolepsy. It's undesirable control of sleep in daytimes. So during such condition, medical aid should be treated where CNS stimulants can be used. And neonatal apnea condition, difficulty in breathing. And chronic lethargy condition or postural orthostatic tachycardia syndrome. And prolonged depression can be overcome instantly by giving some of the CNS stimulants. And in morbid type of obesity condition, very severely observed, in such conditions CNS stimulants may helpful. Coming with the therapeutic indication, only for three conditions these drugs are used in the management of obesity, attention deficiency hyperactivity disorder and narcolepsy. Coming with the therapeutic contraindication, in the following condition, the drug should not be prescribed with the patient having anorexia or insomnia, asthenia, where lot of lethargic condition, muscle weakness can be observed. Even psychopathic personalities, because these people are unstable in nature. So in such condition, if you are continuing, like they may generate some of the episodes of psychosis. It should not be tried. Even if a patient is having a history of homicidal or suicidal tendencies, in such condition also it should not be used. CNS stimulants. That's like only limited applications we have, because we have seen only for three indications the drugs are used in obesity, ADHD and narcolepsy. Then coming towards the types of CNS stimulants, here we have two categories here: psychomotor stimulants and hallucinogens or psychomimetic drugs. These hallucinogens or psychomimetic drugs are highly abused agents, and they are not used medicinally for some treatment and all, whereas psychomotor stimulants have some medicinal values. Let us see about psychostimulants. So it causes excitement and euphoria after administration, and it can also decrease feeling of fatigueness and increases the motor activity. So as the word says, psychomotor. So they are going to increase the motor activity, and this drug it can cause excitement and euphoria, a dreamlike state it can generate. Whereas one more class what you can say which is not used medicinally, so that is the hallucinogens, which is called as psychomimetic drugs. So it can produce change in thoughts, pattern and mood. After taking the drug, the person will be in his own world. So what the thinking capacity or thoughts pattern may also get changed, especially hallucinogenic effects what we call that can be seen. So whatever he is observing, hearing, so it won't be matching with the reality. So he will be in his own imaginary world. So these are the abusing drugs. Many drug addicts will depend on these hallucinogens. Anyway, we have some examples. With the example I will be talking. Let us see about psychostimulants. So these stimulants agent can cause excitement and euphoria. For that purpose the drugs are used, and it can decrease the feeling of fatigueness and even it can increase the motor activity. This is overall use of these psychostimulants. So the example for psychomotor stimulants we have amphetamine, dextroamphetamine, methylphenidate, methylxanthines, caffeine, nicotine, cocaine. Already under sympathomimetics we came across with amphetamine, dextroamphetamine. So anyhow, like in the next slide I will be talking about such drugs. And in hallucinogens we have lyserginic acid derivatives, tetrahydrocannabinol and phencyclidine. Let us continue our discussion with the psychomotor stimulants by taking example of methylxanthines. So which can be observed in tea, coca and coffee. Even some of the chocolates and cola drinks also have this methylxanthines, which include theophylline, theobromine and caffeine. Caffeine as a product you have observed in coffee, tea, coca and other chocolates also. Let us try to understand the mechanism of action. Before entering, like generally you can think about the intake of coffee or tea, like mood refreshing can be observed with the drug. They cause habituation also. Sometimes habituation may lead to addiction, but these are only habituation causing agent. So even they have some therapeutical applications also. Coming towards the mechanism of action, translocation of extracellular calcium it causes. It can increase in cyclic AMP and GMP caused by inhibition of an enzyme called phosphodiesterases, and even it can blockage of adenosine receptors. Now three mechanisms we can observe with the agent, because methylxanthine, if it have to cause stimulation, it should release more excitatory neurotransmitter. For release of excitatory neurotransmitter we require of the calcium. Now calcium level get increased. Also increase in the cyclic AMP level can be observed, because this secondary messenger can activate calcium release, so thereby they can show the response. And the third option what we have with the adenosine receptor, if you block this receptor, auto-regulatory mechanism, so where reuptake will be inhibited and more neurotransmitter will be released. So these are three mechanisms what you can observe with the methylxanthine. It can inhibit phosphodiesterase enzyme, so thereby more and more calcium can be released, because cyclic AMP level increases over here. Increase in calcium in central nervous system and heart can be observed, and decrease in calcium in the smooth muscle. And second mechanism is the adenosine, where it is having three types of receptor, A1, A2 and A3. So this will act as a receptor antagonist. So thereby acting on this receptor A1, A2 and A3, like much of the cardiac effects can be observed. Coming towards the A2 receptor antagonist responsible for the CNS stimulation, and also it causes smooth muscle contraction. Overall, calcium mediated, it can activate the excitatory neurotransmitter release. Say for example, it may be norepinephrine, dopamine release may be enhanced, 5-hydroxytryptamine level also rises. Then coming with the actions of methylxanthine, CNS stimulates property it can show. Now what is the advantages of CNS stimulants means it can reduce the fatigue, and it can increase the mental alertness due to stimulation of cortex and other areas in the brain. Even very high dose can produce anxiety and tremors, because restlessness can be observed and over enthusiasm may be the reason. Even a tolerance to the caffeine can develop, and withdrawal consists of feeling of fatigueness and sedation. Suddenly, if you stop the drug usage, it will lead to fatigueness sensation in a person. So slight sedation can also be observed. At high dose, it is having positive inotropic and chronotropic action. Heart rate and heart contraction rises, and it can cause harmful to the angina pectoris, because they can trigger the premature ventricular contraction. Caffeine has a mild diuretic effect also, so thereby they can increase the output of sodium, potassium and chloride ion. It can stimulate the secretion of hydrochloric acid from the gastric mucosa. If a person is having peptic ulcer, with him it is contraindicated. Then coming with the therapeutical uses, all methylxanthine can relax the smooth muscle of the bronchioles. As you have seen in asthma condition, it can be used. Theophylline was used for asthma, but nowadays we have better agents like beta-2 antagonist. Beta-2 agonist, which can be used, and along with corticosteroids, so which can cause broncho relaxation. Coming with the adverse effects, insomnia, anxiety and agitation can be observed. The next drug under stimulants, that is nicotine. You might be heard in cigarette or in tobacco, nicotine can be used, but they are not used therapeutically. Only I told CNS stimulants, only few handful of drugs are there for using medicinal purpose. But nicotine is having some therapeutical application in cessation of smoking. In withdrawal of smoking, it can be used. Stimulation of sympathetic ganglia is a mode of action. Once the sympathetic ganglia increases, it can release more and more norepinephrine, that's noradrenaline. Thereby, it can increase the blood pressure and heart rate. So, thereby, CNS stimulation can also be observed because of excitatory neurotransmitter. So, they are contraindicated in the hypertensive patient because we know norepinephrine can rise the blood pressure also. Nicotine can cause vasoconstriction and even decrease in the coronary blood flow, adversely affect the patient with angina. Even high dose of nicotine can result in respiratory paralysis and severe hypotension can be observed. So, it may be caused because of the medullary paralysis. Only with a higher dose this can be seen, not with the minimum dose. Along with other components of cigarettes, it will be having some of the agents like tars and carbon monoxide. So, along with nicotine, so they causes some cardiovascular complication and it may cause cancer also, because for production of cigarettes, it will be used with tar, because to catch the fire it is used. It is a carcinogenic. Then coming with the nicotine, as I told, it is a addictable drug which causes dependence. Suppose suddenly if you stop, it causes withdrawal symptoms including irritability, anxiety, restlessness, headaches and insomnia can be observed. In smoking cessation program, behavioral therapy will be conducted with the patient. Even nicotine replacement therapy can also be helpful, where nicotine will be given in the form of a transdermal nicotine patch, or nicotine chewing gums are available nowadays in the TV advertisements you are coming across with Nicotex. So, it can produce sufficient amount of nicotine concentration in the blood, so thereby nicotine craving can be reduced. So, here in the graphs you can see the nicotine concentration by the cigarette. A sudden hike you can observe on the administration with 1.5 cigarette, it can be observed. Even the similar we can observe with the nicotine gum, chewing gum. If you are using 2 pieces of chewing gum can serve the day requirement. Blood concentration can be seen, or there is a transdermal patch also. Slowly there will be a release of nicotine. Thereby nicotine craving won't happen and patient won't go for taking the cigarette. So, even one more drug which can be combined along with the nicotine for tobacco cessation program, that is a bupropion. So, it is an antidepressant agent which can also decreases the craving of the cigarette. So, then other than we have varenicline. So, this is a partial agonist at the neuronal nicotine acetylcholine receptors in the central nervous system. So, it produces less euphoric effect than the nicotine, because you know about the cholinergic receptor. So, nicotine will activate on the nicotinic receptors in the ganglion. So, once the ganglion get activated, so there may be a chance of release of excitatory neurotransmitter like norepinephrine in the postsynaptic nerve, because all the preganglionic nerves are cholinergic, but postganglionic nerve either it may be adrenergic or cholinergic. So, it can be used as an adjuvant in the tobacco cessation program. Smoking can be quickened by using this. So, even it can be used for the people who are willing to discontinue smoking. So, next drug under the category is the cocaine. It's a strong stimulant, mostly used for some of the recreational purpose. It's not used for therapeutical purpose. So, commonly it will be snorted or inhaled or injected into the veins. It is addictive. After a short period of use, there is high risk such that dependence can be observed with the patient. They are not therapeutical use, but only for the recreational purpose. Many people will depend on the drug, and it starts with the addiction. But general mechanism, if you see, so they comes under the CNS stimulation. In the classification of psychomotor stimulants, we came across with the drug amphetamine and cocaine. Both these cocaine and amphetamine as classified as Schedule 2 by the US Drug Enforcement Agency. Both they have potential addiction liability. It's considered as a drug of abuse. Coming with the mechanism of action of this cocaine, as I told, like excitatory neurotransmitter should be raised. So they are going to block the reuptake, because once the neurotransmitter got released from the nerve terminals, excess neurotransmitter will be taken back. So now this cocaine, what it does means they are going to block this reuptake mechanism. So once the reuptake got blocked, so many of the excitatory neurotransmitter will be freely available, like norepinephrine, serotonin and dopamine, so that it can potentiate and for a longer time it can cause CNS stimulation, because there will be increase in the monoamine levels. Monoamines are norepinephrine, serotonin and dopamine. So increase in the response can be seen for longer times. Even as cup of tea or coffee, so similar mechanism it can observe. But cocaine is highly addictive and potency wise its action is more. So coming with the physiological responses, so intense euphoria can be observed by taking the drug. The person will think like he is in his own dream world. So this will happen because it can raise the dopaminergic level in the limbic system. So this limbic system dopamine level increases will lead to some pleasure effect, like he will feel happiness because of this, and he will be in his own dream world. This is what will happen in the brain. Then chronic intake of cocaine can deplete the dopamine level also, because all stimulation will end with the depression. This depression can triggers the viscous cycle of the craving for cocaine. So thereby temporarily it can relieve severe depression also. So then coming with the overall mechanism, so it can inhibit the reuptake of norepinephrine, serotonin and dopamine, so in the presynaptic nerves thereby. So it can increase the amine neurotransmitter. So it can bind to monoamergenic reuptake transporters, so thereby potentiate and prolongs the CNS and peripheral action of these monoamines. Even prolonging dopaminergic effect in the brain, such that pleasure system produces intense sense of euphoria in initial days, and chronic intake of cocaine depletes the dopamine, so thereby craving of cocaine may happen, because once the dopamine level decreases, so more and more craving will happen with the cocaine. Similarly we observe with the nicotine also. Once again cocaine if you take, and dopamine level may rise. Then coming with the action, almost resembling action you can observe with the previous drug what we have seen. CNS stimulation can be seen, and it can produce euphoria, increase mental awareness and can cause hallucination. When in high dose it can cause convulsion followed by respiratory depression. It can activate sympathetic nervous system, so thereby chances of tachycardia and hypertension can be seen, because more norepinephrine can be seen. Even baroreceptor reflex may be impaired by this. Even hyperthermia can be seen, because cocaine is one of the different drug or unique drug under the illicit drugs, that death can result also from the drugs ability to cause hyperthermia. Even a small dose of intranasal cocaine impairs sweating, cutaneous vasodilatation can be observed, and perception of thermal discomfort can be seen. Because of that many times the person will end the life also, because they have property to cause hyperthermia. Then coming with the therapeutical uses, cocaine has local anesthetic action and represents its current therapeutical use, but we are not using it because addiction liability can be seen. Even cocaine is applied topically as local anesthetic during eye, ear, nose and throat surgery. This is a property it's having, but under local anesthesia you have seen the classification. That's the local anesthetic action of cocaine is due to the blockage of the voltage gated sodium channels. So let us move on to the adverse effects. It causes anxiety, depression, agitation, seizures and fatal arrhythmias can be observed. These are the adverse effects of cocaine. The next drug is amphetamine under sympathomimetics also. You have came across with that drug, like they causes CNS depression. So how they causes stimulation, like a release of intracellular stores of catecholamines can be observed. Catecholamines examples are norepinephrine, serotonin, dopamine. So then other than this, it can inhibit monoamine oxidase also. This monoamine oxidase can metabolize norepinephrine and dopamine. So if inhibition of this monoamine oxidase occurs, this is an enzyme. So there will be rise in norepinephrine level. Other drugs which resemble to amphetamine derivatives, dextroamphetamine, which similar to the amphetamine. One more like methamphetamine drugs, similar responses. They have some therapeutical uses in ADHD. Coming to the pharmacological action, they are CNS stimulants and they can increase alertness, reduce fatigue and depress appetite. They can activate the sympathetic nervous system, can cause depletion of the substances. So dependence can be seen. So because of this, limitation can be seen upon the usage. So this is the mode of action. So as a conclusion, we can conclude here. It can increase norepinephrine level. So thereby it can show the response. They can release intracellular stores of catecholamines, which include norepinephrine, serotonin, and dopamine. And also they can block an enzyme monoamine oxidase. So thereby catecholamines concentration will be get increased. Coming with the therapeutical uses of amphetamine. So this can be used in ADHD, attention deficient hyperactivity disorder, and even appetite control purpose it can be used. It's having a property to decrease appetite. So then other than narcolepsy, I told in the introduction, unavoidable sleep during the daytimes, amphetamine, methylphenidate can be used. Then coming with the adverse effect of amphetamine, insomnia, irritability, weakness, palpitation, arrhythmias, hypertension, nausea, vomiting and diarrhea can be seen. It is contraindicated with hypertensive patient, cardiovascular diseases, even hyperthyroidism, or any people who are taking with MAO inhibitors, they are contraindicated. Because already about the serotonin syndrome you have seen in antidepressant agents. So next drug under the same category is methylphenidate. So they have CNS stimulating property. So mechanism of action and its usage. It can be used with the children with attention deficient hyperactivity disorder. They can produce weak dopaminergic signals, which suggests the person who is taking interest will be developed because it's having some of the rewarding action. Rewarding always will be in association with some of the clues. So now once the reward get activated, reward center in the brain get activated, more and more dopamine will be get released. So thereby it can be helpful in ADHD. Methylphenidate is a dopamine transport inhibitors and may act by increasing the dopamine in the synaptic cleft. Used in ADHD in children, and these drugs also can cause dependence. Coming towards the adverse reaction, abdominal pain and nausea can be observed, anorexia, insomnia, nervousness and fever can be seen. Even this methylphenidate can interfere in the metabolism of various drugs, warfarin as an anticoagulant and phenytoin anti-epileptic agent, phenobarbital and barbiturates we came across sedative, hypnotics and tricyclic antidepressants. So next category under CNS stimulants, so it's hallucinogens. The psychomimetics are only used for the recreational purpose. They are not used for any therapeutical application. Drugs that can induce altered perceptual states accompanied by visions of bright, colorful changes in the environment. Once the person have taken the drug, like he will be in his own dream world, the perception only will be get changed. So visual hallucination can be seen, or he will be in his own dream world after taking the drug, and he will feel it as a reality, such that whatever the stress he will be having in the outer circumstances, it won't be affecting him. So the people will become addict because of this. He will be feeling happy towards the surrounding. So even these drugs impair normal decision making because they interfere with the rational thoughts. The mind thinking capacity only will be get disturbed because always he will be under the hallucinogenic state. In schizophrenia also you came across with hallucinogenic response where the person will be in his own dream world. So that will be somewhat more potency when comparing with the hallucinogenic responses. Let us see about the hallucinogens. They are also called as psychotomimetic agents. So it stimulates the central nervous system, so thereby it can change the feeling of mood, and also thought process or the pattern of thinking will be get altered. So it's having effect on the brainstem and spinal cord. So the person will become incapable of normal decision making because drug will interfere with the rational thoughts. Many of the drug addicts who might be observed, like they will be in the confusion state because the drug will be interfering in their thought. They cannot take their own decision. The example is the lysogenic acid derivatives. There is an lysergic acid diethylamine. I was telling about the category, like they are not having any therapeutical application, only for abusing purpose it is used, and for the parties, drug parties who might be had, so these drugs are used. It is called as a psychedelic drugs. So example, they comes from the ergoline family. Ergot derivatives you might be studied in pharmacognosy. It's an naturally occurring substance. So with that, the derivatives, lysogenic acid derivatives, they have these hallucinogenic responses. So sometimes like it is having non-addictive responses. So it is one of the smuggled drug in the form of blotter design. It will be used. This is a blotter design paper where the drug are embedded on it, and a small piece will be taken and it will be kept in the mouth. Whatever the lysergic acid which is soaked in the paper, so that will be get distributed into the circulation. So thereby it can show some responses. Then coming with the lysogenic acid derivatives and its mechanism. So they are considered as the serotonin agonist. So they can raise the serotonin level. Even activation of the sympathetic nervous system occurs because of this. We can observe pupillary dilation. There's the mydriasis can be observed. Increase in the blood pressure can be seen, and also increase in the body temperature can be seen. All the responses partly because of the serotonin and norepinephrine. They are taken orally. Low dose of LSD can induce hallucination and brilliant colors can be observed. Haloperidol and other neuroleptics can block the hallucinogenic action, as you came across with antipsychotic agents, because all the responses indirectly, so they are going to affect dopaminergic responses. Coming with the adverse effect, hyperreflexia, nausea and muscular weakness can be seen. Even high dose may produce long-lasting psychotic changes in a person. One more drug under hallucinogens is the tetrahydrocannabinol. So it is obtained from the marijuana. It's a naturally grown plant in that use, but its sale is under restriction. It can produce euphoria followed by drowsiness and relaxation, and can cause hallucination. So this tetrahydrocannabinol will act on the cannabinoid receptor in the brain, so thereby they can show this type of euphoric response. Then coming with the effect, it's having appetite stimulants, and also xerostoma and visual hallucination and delusions can be observed. Coming with towards the adverse effect, short-term memory and mental activity will be decreased, and muscle strength, and it can impair highly skilled motor activity with the person. Increased heart rate can be seen, decreased blood pressure, even reddening of the conjunctiva can be observed as a hallucinogenic effect. Many of the addicts you might be observed, so that their conjunctiva will be red because of the adverse effect of the drug. If they are in the marijuana, so we will come across with such responses. High doses are very much toxic, and sometimes psychosis can be developed with the patient. So the one more last drug under the category is the phencyclidine. So it's an illegal drug. Nowadays it's banned, it's not used also. This is also called as angel dust. So because it can cause some dream-like state with a person, and happiness will be induced in a person. So thereby it is considered as angel dust. So it will increases the dopamine level by blocking the reuptake. So and also 5-hydroxytryptamine norepinephrine level will be rises. Total stimulatory neurotransmitter level rises. It can produce numbness, and also slurred speech and muscular rigidity can be observed. At increased dose, it can cause anesthesia, stupor and coma. Increased sensitivity to the external stimulus will happen. So thereby CNS action may persist for a week.